Hello, doctors. Hoping all are well. Today, our session regarding actually patch tricks and passage-wise, so we are collecting ongoing cases, right? So my voice clear, doctors?
Yes.
Okay, thank you. So first, mock will be, first case will be our long case clinical consultation, and according to our voting, there is a multiple candidates were voted as a active participation. So I'm seeing that Dr. Ada is here. Okay. If Dr. Ada not here, Dr. Sumbul. Okay. Then Dr. Faisal.
Yes, I am here.
Okay. So are you ready for participation of the long case clinical
Yes.
consultation? Okay. So regarding the long clinical case consultation, before we'll get 5 minutes, there will be also another case. So better to within 2.5 minutes, we'll prepare ourselves. So I'm giving you 3 minutes, Dr. Faisal. Then you'll keep your format according to your format of what you are practicing nowadays. That according in the case wise, okay, you have to follow. Then I'm starting, okay, doctors. So I'm
Okay.
giving and time is started. Let's start. So let's start, Dr. Faisal.
Okay. Hello. Hello there. My name is Dr. Faisal. I'm one of the doctor in the medical admission unit today. Are
Yes,
you
doctor.
Mrs. William Blue and 45 years of age?
Yes, doctor, I am.
Okay. So, Mrs. Williams, today we are here to discuss. Today I'm here to talk with you at the same time examine you. Is it all right?
Fine, doctor. It's fine for me.
During my consultation, if you found any pain and discomfort, please let me know. I'll be gentle.
Thank you, doctor.
So, Mrs. William, could you please tell me what brings you here today?
Yes, doctor. I'm very much afraid for last 2 weeks. I have vision issue. I was full total well 2 weeks ago, but for the 2 weeks it's worsening.
Okay, so sorry to hear that, but don't worry, we are here to help you out. I have couple of more questions regarding this. Is it all right?
Okay, doctor.
Okay. Was it start suddenly or gradually?
Doctor, you can say it's gradually, as it is last 2 weeks, and I was not bothered about that because I was trying to avoid sunlight. I am just feeling of the comfortable, but it's really irritating. I'm feeling so much dryness of my eye as well.
Okay. So you said you have visual problem. What do you mean exactly by visual problem? Is it double vision or loss of part of vision?
Doctor, you can
Or-
say last 2 day, okay? I'm
Hmm.
seeing some double when I'm trying to move my eye. I see some double. So when I'm trying to take some sleep, sometimes I feel good, but I'm not actually can correlate that what's actual factor for having this. I try my best for taking sleep, taking rest, but it's also there.
Okay. Do you have any difficulty in vision? I mean, seeing things like blurry vision, or you cannot see in certain distance?
No, doctor, it is
Okay.
all right.
So, okay, for last 2 weeks, it was like some discomfort, but last 2 days it become, double vision when you try
Ye-
to see something,
Yes,
right?
doctor. You are right, doctor.
Okay. Is there any similar history in the past,
No,
or is it
doctor,
the
it's
first time?
totally new. No, doctor, it's new for me.
Okay. And I guess it is persist all the time with you or coming in and off in nature.
Doctor, regarding this dryness, gritty sensation is always is there, and but this double vision, I think sometimes I feel double, sometimes totally okay for me. I'm not sure about that actually.
Okay. Have you noticed anything worsen your condition
No, doctor?
after a while? Is there any direction like more after towards the end of the day or all over the day or morning?
No, doctors, always there. There is no association like that, what you were asking for me.
Okay. And anything makes it better?
Nothing, doctor. I try to keep my eye moist, but it doesn't feel any comfort for me.
Okay. So you also mentioned that you have difficulty in seeing light. Is it still bothering you?
Yes, doctor, you're right. Whenever, as you know, I'm working in the film industry, whenever I try to see sun exposed, I feel some irritation. So I try to avoid those.
Okay. That's good. Okay. So do you have any issue, any feeling sick, getting sick,
No,
or throwing up?
no, no, doctor.
Okay. Do you have any history of headache?
Headache, no, doctor.
No headache. Any history of neck stiffness?
No, doctor, I don't have.
Any history of rise body temperature?
Not now.
Not now. So you have this one.
Last month I have some flu. I was just taking from some medication from the GP and I'm still totally okay now.
Okay. Any history of fits?
No, doctor.
Okay. Any abnormal sensation, tingling, numbness sensation, any parts of your body?
No, doctor.
Any history of altered speech and altered sensation?
No, doctor.
Okay. Any history of unsteady gait or difficult to walk?
Unsteady gait mean you are asking for gating abnormality? No, doctor. I
Yes.
can walk properly.
Okay, that's nice to hear. Any history of loss of water work and bowel control?
No, doctor. I didn't notice this type of the episodes. Never.
Okay. So, Mr. William, do you have any non-medical condition that I must be aware of?
Non-medical condition mean what, doctor? I
Any
didn't get
known
you.
diagnosis or any long-standing condition?
I don't know actually.
Do you have any high blood pressure, high blood sugar, or high cholesterol level?
No, doctor. I don't
Okay.
think so.
Do you have any what medication? Do you have any current medication list?
Current medication list? No, I don't have any kind of the medication.
So, have you taken any over-the-counter medication?
Sometimes I need some taking some multivitamin. My GP said for my well-being as I feeling some tiredness, so that I'm just taking it. But I don't feel so good
Oh,
nowadays.
I understand. Sorry to ask this question, any history of any recreational drugs?
No, doctor, never.
Okay. Sorry for this. Actually, this is the question you usually ask this every patient. Please don't take it personally. Are
Okay,
you
doctor.
allergic to any medication?
Allergy? No, I don't think so.
Okay. Any similar condition runs in your family?
Like what, doctor?
Any long-standing disease or any history of cancer or any long-standing diagnostic condition?
Doctor,
Any family
actually,
member?
I'm very much afraid. My father has stroke, so that I'm very afraid as I'm really young, so how it could be possible. I'm very afraid. Yeah, my grandmother, she has breast cancer and she is on still chemotherapy. I believe it is not due to cancer, right, doctor?
Okay, I appreciate your concern. Don't worry. I will meet this concern at the end of my consultation after I finishing my exam. Okay, after my
Okay,
finishing my
fine.
question. Okay, okay. Do you have any history of surgery?
No, doctor, never.
Any history of recent procedure?
No, doctor.
Any history of blood transfusion?
Blood transfusion? No, doctor, never.
Okay. So, may I? What about your weight?
Doctor, you are very good question. You're really very good, doctor. I don't know. My appetite is really good, but why I'm losing weight? Yes, I do gym. I'm doing the jogging. Yes, it's true, but it doesn't mean that I'm losing weight. For last 2 months, I'm losing weight, and it's not intentionally.
Okay. And how much kg over how long?
Yes, you can say last 2 months is around 4 kilo.
Or 4 kilo. Do you have any weather preference?
No, doctor, I don't have.
Do you feel excessive yeah, cold or warm?
No, doctor, I don't think so.
Okay. So do you have you said do you have a fatigue, right?
Yeah, doctor, always I feel tired nowadays, but I don't know why. Even I'm taking good food and I'm taking multivitamin, but it's not going go wait for me.
Okay. Have you noticed, is it any particular time? Is it all over the day or at the end of the day?
Always, doctor. Always I'm so tired.
Always tired. If you do some work, does it make it more worse?
No, doctor, it doesn't seems like that.
Okay. So, so do you have any racing pacing of your heart? Do you feel that?
Doctor, I just newly joined in this film. That's I want to be a model. So I think due to my stress, it could be this racing of the heartbeat. I tried to get relaxed, but I you see it's there. There's a racing of the heartbeat is there. You're right.
Okay. Okay. Have you tap over it? Can you feel it? Is it regular? Is it come at regular interval or is it irregular?
I feel so it's a little bit regular. It could be due to some taking caffeine. It could be, but I'm not bothering about that.
Okay. Okay. Any shakiness of your hand?
No, doctor.
Okay. Any chest pain?
No, doctor. I have
Any
some
shortness?
little bit discomfort. You can say this way.
Okay. Any shortness of breath on
No,
rest
doctor.
or
I don't.
exhaustion?
No, doctor. It's not there.
Any issue of swelling of your leg?
No, doctor.
Okay. Do you have any difficulty in swallowing?
Swallowing? No, doctor.
Okay. Do you have difficulty standing from sitting position or combing up of your hair?
No, doctor. I don't feel so.
Okay. What about your water work?
What about that? What do you want to know?
Water like any change in amount, color, or frequency?
It's totally okay for me, doctor.
Okay. Any fuzziness in urine or water work?
No, doctor.
And what about your bowel movement?
What about that, doctor?
Bowel movement
I
like
mean, what?
a loose motion or hard motion?
I didn't notice anything. Sometimes I feel it's okay for me.
Okay. So I want to examine you. Is it all right?
Sure, doctor.
I want to examine, start from the eye. I
Okay.
want to see the visual acuity first. First, have a good look of the eye.
The eye you can see from the outside, and you are inspecting the eye. Then
Then I want to see the visual acuity.
visual acuity is normal, doctor.
Now I want to see the visual field.
Visual field is normal.
Okay. Now I want to do the 3, 4, 6 for any
Three,
lateral
four.
palsy.
Yes, in laterally sometimes patient is I am seeing some double is there.
Which side?
It's laterally open is abduction.
Yeah, right or left?
Right.
Right, right side. And other than this, no visual restriction, right?
No, doctor.
Okay. Now I want to also perform the fundoscopy.
Okay, it's noted. You can do later.
Okay. I want to see the hand,
What you want to see?
a pulse.
Pulse is as outside, and you can calculate now. It's about 110 beat per minute.
100. Any tremor,
There's no
shakiness?
shaking. No.
There is no shaking. I want to oscillate the chest for any murmur.
So you are keeping your state over the precordium, right? So there
Yes.
is no murmur in the precordium. Anything else, doctor?
Yeah, carotid bruit
There is no carotid buoy, doctor.
and base of the lung.
It's normal. Anything else, doctor?
I have some question, if you don't mind. Now I want to few question.
Sure, doctor.
May I know what about your period?
Doctor, it's less 3 months. I think there is some slight. I mean, amount is very slight. It's less. You can see.
Is less.
Yes, it's little bit.
Okay. Have you? Yeah. Are you on any kind of a
2
birth
minutes
control scheme?
left. No,
Any history of pregnancy loss?
no, doctor.
No. Okay. Uh, okay. As
Anything else, doctor?
yes. May I know what are you doing for a living?
I said you. I just recently joined in the film industry. I want to be a model.
Okay. And do you drive?
Yes, definitely.
I advise you please stop driving unless we find out what exactly causing your eye problem. Then we will let you know. And do you have any weakness, any parts of your body, any hands or leg weakness?
No, doctor.
Okay, I want to check the plantar.
Noted, and it's normal.
Okay, normal. So
Do you want anything else examination, doctor?
yes, I want to examine the cranial nerves. Is there any? I want to seven cranial nerves
Okay,
and the
noted.
tongue.
No need. No need.
No need. Okay. So and behind the ear,
What you want to say, doctor?
any scar mark or any rashes, anything?
No, doctor. It's
Do
completely
you have
okay.
any? Do you have any history of joint pain or skin rash?
No, doctor. Your time is
Oh,
passing. Only
okay.
10 minutes
So,
left. 10 seconds left.
so most probably, Dr. Mrs. Williams, we need to admit you and urgently do some tests, including scanning
Time
of
is
your
up.
head.
Thank you, doctor. So 1 minute for recap. Just
Hmm.
recap your positive finding and you'll start 1 minute later. Okay.
Okay.
So, doctor, could you tell me what are the positive findings in your case?
In my case, patient has some double vision, more on the right gaze.
Mhm.
Patient also complain about the fatigue.
Okay.
And on examination, I found there's a right six nerve palsy,
Okay.
and patient has some tachycardia.
Okay, doctor.
Okay, and there is a little bit tremor also.
Did you notice this shaking or not?
Yeah, you told me there is some shaking.
Okay. Anything
Okay.
else, doctor? On vision, on inspection, any finding? Did you notice?
Uh, no, actually, I need to see
So,
the.
doctor, could you tell me, according your examination and the communication, what is possibility of your differential or is only diagnosis you have?
Actually, there could be a possibility the right six nerve palsy is there. So it could be raised ICP, some things there. It could be, my first defense will be regarding the patient age, multiple sclerosis. Okay.
Okay.
And I need to exclude the other vascular cause like CVST, all the patient doesn't have any headache history.
Did your patient complain of headache? Do you notice?
No, no.
For raised ICP, what are the positive finding, doctor?
Raised ICP, actually the vision, six nerve palsy can present as a form of a raised ICP. That's why I need to exclude.
Why a multiple sclerosis you are thinking?
In multiple sclerosis, it can present as anything like double vision regarding patient age.
Mhm.
It can be a possibility. In young patient, we need to exclude the MS.
Okay, did you offer anything for that reason? Any
Uh,
social help did you offer the patient, doctor?
no, actually, I didn't get time. I running out of time, but it was part of my plan.
Doctor, if I say that your patient the low menstrual cycle, what else you are thinking?
I was thinking some thyroid problem also.
So do you want to add on your differential, doctor?
Yeah, my next eventual will be thyrotoxicosis.
So
But
doctor,
patient
could
has
you tell me?
no. But against
Mhm,
that patient, the only
mhm.
thing patient didn't say me any weather preference. He said he's
So
okay with that.
so it is only strong sign you are trying to say, right, doctor?
No, this is
Weather
one of mine.
preference.
But patient has history of weight loss, tachycardia, tremor.
Mhm.
Uh,
Last baby age was 6 months ago. So
but I asked the history of any surgery procedure, hospital admission. Patient didn't give me anything about that.
only there is a normal vaginal delivery. Last age of the baby was 6 months ago. Okay. So tell me how you'll investigate.
Okay. It's in this case, patient is 6 months ago. So I want to do the full neurological examination. I also do the scanning MRI of the brain.
Mhm.
Okay. and also the hormonal panel of thyroid, ACTH, LH, all level to see for any hypopituitarism present or not.
Anything else, doctor?
And
Any
I also
specific investigation you want to do for your diagnosis? To reach your diagnosis, what you want to do according to diagnosis?
I am to do the thyroid function test.
Okay. So, doctor, could you tell me how you'll manage your case?
Okay. We will form a multi-disciplinary team, including gland doctor, eye specialist, special nurse, social health worker, occupational health worker, then to give a proper care and plan of management, and management will be according to the underlying cause.
Okay. What else? Is there anything else you want to add there in your management?
I ask the patient to,
so
if
thank
you
you,
go
doctor.
outside. Okay.
Thank you. Your time is up. Thank you, doctor.
Thank you.
So now let's start our discussion according to your marking. Okay.
Okay.
So, Dr. Faisal, regarding your communication and justification, overall the marking will be like that. First of all, if we start from the communication and the relevant investigation, relevant positive finding, this is very important to rule out. If you say there's a weight losing unintentionally, though there's a good appetite, 1 point, very important. Second, there is a grave ophthalmopathy or not, there is a protrusion of eyeball. You have to see as it is the initial started and the gritty sensation why it is, right? So weight loss, like exophthalmos type presentation, if you see the picture, I'll show you later again, so you can see more. And there's a slight enlarge of the thyroid gland, which you didn't examine ever, even if you don't get any kind of the information, even you didn't offer the patient. Even sometimes every center there's a not typical patient is there. So you have to offer the patient, I want to see the thyroid gland for sure, because patient have low menstrual amount, that's like a little bit. So the positive finding is there, and the evaluation, is it Graves, is it hyperthyroiditis 1 month ago, this flu-like illness, so association. So doctor, overall your differential multiple sclerosis in case ICP, prolactinoma, whatever you want to say, there's no relation according to our positive finding, right, doctor? So that what happened that you miss mainly female 3Ps, ask pill pregnancy, you didn't ask last baby age, what you missed. Regarding 3D, dyspnea, okay, you asked the shortness of breath, okay. You asked regarding the dysphagia.
Shortness of breath is the same thing.
Yes, I said, yes, you asked this 3D, right, dyspnea, difficulty of swallowing, but you see the enlargement is very mild. So you have to exclude those questions, right? Is it mild, moderate? What about this is subacute postpartum thyroiditis? Actually, the family history, breast cancer, is there any autoimmune condition? No question regarding the autoimmune history, right, Dr. Faisal? So you didn't ask any autoimmune specifically. You asked just you have any past medical history. The patient will never say about that if you don't ask any
but
kind
how
of.
Can I ask about the autoimmune? This is the known medical condition. If he is diagnosed with any condition, the patient
you're
should.
right. You are right. So you have to ask nicely that I am asking some condition that do you have any diabetes from the childhood? Do you have any kind of the skin rash on the sun exposure, like ACLE? So autoimmune condition, you have to ask yourself, right, Dr. Faisal? Patient will tell you, no, I don't have anything. So you have to ask, you have to exclude those condition. Is it association, right, doctor? So if you see the marking, physical examination fully you missed regarding the thyroid, it will be the unsatisfactory. Identifying physical sign, there is you oscar the bruit of the cardiac, not thyroid gland. You didn't percuss, you didn't examine, so fully it is unsatisfactory. Clinical communication, I'm just giving you borderline just for that. Yes, overall it was okay. Someone may give 2 and some borderline, I mean 3 you can get, but actually from my side, if I don't want to be strict examiner, I can give you 3 overall, okay? Because it's a pattern of the format. Always the weight loss, vision problem, association. So your format was not organized, Dr. Faisal. So you have to work on
why
that.
There is no weather preference?
Okay, that's not obvious over weather preference. Patient told you that I don't notice, I don't feel so. So patient working environment some can be matter. It's not a significant strong story for your weather preference. Okay, doctor. So clinical communication, differential, I couldn't give you more, and clinical judgment, same way you told me third function, I have to rule out, I have to do every function. It's fine, clinical judgment, and you didn't offer. You give driving stopped, okay? And overall clinical judgment, again 3 like that, okay? And managing patient, even you don't ask any concern. I said timing is going, you didn't ask any concern, so it's really unsatisfactory. So overall, Dr. Faisal, your mark I don't want to say in details, so it's your performance today. So I'm not discussing today our case. This case was in India actually. Thank you, Dr. Faisal. I'm discussing, then I'll give you feedback again. So the patient presentation, this treaty sensation of the 2 weeks, right? So there's a sunlight irritation. So that's kind of the complaint patient was telling, anxious, new job is there, fin industry, is there any cancer, is this any kind of the stroke? So I believe, so this kind of the 11, they're just trying to, they are trying to, not full concentration, right? Just trying to the misguiding you, the patient, right? Patient always, I mean, surrogate always try to misguide you, but we have to be very strict according to our format, very strong format regarding the vision problem, visual loss. Is that neurological? Is it endocrinologic? Where actual problem? What I am dealing, right? Endocrine or neurological. First, whenever patient telling weight loss, it doesn't mean it is neurological. So multiple sclerosis, neurological, that doesn't sounds good, right? So there is also menstrual cycle is less in amount. Okay, there is eye prettiness, heart rate. I said 110 if you count there. Mild goiter is there. Okay, there's dermopathy. You ask the skin lesion, or there is an edema is there. Proximal myopathy didn't examine. Third examination didn't
But I
examine.
asked.
Okay,
Asked
which one?
any difficulty in proximal myopathy, difficulty in combing of hair,
Yeah, you
standing
asked,
on
but the
fetal position.
examination important, right, Dr. Faisal? You have to
Yeah.
also examine the patient. You have to tell that I want to do the proximal myopathy. You asked, but there's no finding, but you have to do so, right, Dr. Faisal? 15, I
Yeah.
mean, 14 minutes is not a less time like before, like short BCC 10 minutes, that is a very good time if you have to be expert one, right? So regarding the DD, it was like first as a postpartum subacute grapes, whatever according to the positive finding, it's 6 months ago, there's a delivery of the baby, postpartum, then subacute, you can say this way, grapes this way, you have to keep your differential. So Dr. Faza, overall, you just misguide whenever patient told you that there's a no weather preference. That doesn't mean any sound. Weather preference, not always obvious sign, any patient, even patient will misguide you. Surrogate, very expert how to misguide the patient, okay? How to misguide the doctor. So the anxiety, irritability, even you didn't ask regarding the mood, right, doctor? So there is a in bulging of the eyes, grapes. If you see there is a bulging of if you see in, it's not obvious patient, they'll say till as grapes
Actually,
ophthalmologist no.
this picture misguide me. It's from the up. If you take the picture straight, then you can see, you cannot see the lower part of the sclera. Then why you should
Okay.
suspect the exophthalmos? You
So it is
can
the
see the
issue
upper part of the sclera.
actually this type of the patient, real patient, and actually doctors who did this, they didn't understand, also miss the diagnosis. It's not my fault, so from the candidates who given the same feedback. Okay, Dr. Faisal. So
Yeah.
actually
No,
my
I understand,
main,
but I'm just discussing with you. Now
okay,
look at you. You can see both the
there's no
upper
lead
and
light,
lower
there's no
cannot
lead
see.
restriction, there's no lead light,
Yeah.
there's no lead restriction, right? So is there
Yes.
exophthalmos? So it's a possibility, though I couldn't appreciate from our examination. That's it. You can say it's my possibility, but I couldn't have, because subacute thyroiditis postpartum, it doesn't look like this way. You understand? So there's
Yeah.
is it positive finding? It's not positive finding. It's a normal finding actually. So the patient is like actually subacute thyroiditis, or some centers they keep as postpartum thyroiditis, right, Dr. Faisal?
Yeah.
So
Yeah.
this actually, I said that obvious sign may not present in long clinical consultation, right? Very important that obvious sign and obvious positive finding may not, you never get it. Sometimes it will really happen in India center, actually in all over the center, obvious and real clinical presentation. So we should be very expert on that. How to do this? Weight loss, lack of menstruation cycles, so low volume, there is an beauty sensation, and only for the 2 days. Why double vision? So you have to be expert on is it neurological or is it endocrinological, right, Dr. Faisal? You understand?
Yeah.
So thank you, Dr. Faisal. This is our performance for the long clinical concentration. I take the question later after the communication. Thank you. So the communication will be start with me. One candidate was asking me, it's a doctor, if I say, it's a doctor Dinesh something, if I'm not wrong, Dinesh Varanasi,
Yes,
right?
doctor. I'm there. I'm there.
Okay.
Yeah, yeah.
So doctor, your time is 2 minutes, just starting the timer, and you start the preparation, okay?
I couldn't see the case.
Okay, no problem. I'm giving the picture fully. You can see?
Yeah, I got it, doctor.
Okay.
Thank you.
So doctor, are you ready?
Yes, doctor. I can. Yeah,
Okay.
I can go
So
ahead.
let's start.
Yeah. Hello, this is Dr. Dinesh, one of the doctor in the cardiology. Is this Mrs. Mahevish, that 55 years old?
Yes, doctor, I am.
Yeah. Yeah. Hello, ma'am. How are you doing today?
Yes, I'm very excited. I'll be discharged today. So when I'll get discharged, doctor?
Can you give me some time to explain today's our agenda of the meeting? Is that okay?
Yes, sure. Tell me.
Yeah. Today, yeah. Today we are here to discuss about your what has happened to you and what all things are happening. And I understand your expectation. Would you like anybody else to be with you to have this conversation?
No, doctor, it's fine for me. You can carry on.
Uh, as you know, like, could you, if you could, like, tell me how far do you know about your thing and what happened, or you want me to tell that?
Yes, doctor, I know very well that yes, some your consultant said to me that I have some irregular heartbeat. And yes, I have one episode of the loss of consciousness. Then I visited your cardiac team. Then they said that I need some it's called pacemaker. So okay, fine, and they did it yesterday.
Mhm.
And they said that they will discharge today, and I'm waiting for that. That's it.
Yes, I completely agree to what you said, ma'am. Like, you came like that, and our team has decided to place you on something called a pacemaker. Everything well, the procedure, as you know. I just want to reconfirm again. You don't have any other symptoms, correct now?
No, I am totally okay.
I'm Yes. Uh, Ma'am, I need to break some news to you. I'm afraid it is not so pleasant. Is that okay?
Oh my God, what you're telling. Today I'll be discharged. So what's news you are coming to me that says not pleasant? So what is that?
Uh, During the procedure, when we placed the so-called pacemaker, there are some places where we have to keep uh, the the point of electricity where it goes to heart, as you know, I believe.
Yes, I know.
So what
Yeah.
happens is, yeah, what happens is when we do this, there is a chance that at times one of the position may not be correctly placed and it gets misplaced.
Oh my
And
God. What
unfortunately,
will
this has
happen?
happened in your case.
Oh my God.
Uh,
So no one told me that. And from morning, I was ready for being discharged, and you're telling me right now why? What's the to happen? I mean, how? I don't have any problem. I want to go back to my home because I'm waiting for my this ceremony, wedding ceremony.
I can completely understand, ma'am, like what you're going through now. This we have come across today in the follow-up checkup, the consultant and our team, when we were checking you after the procedure, in the routine rounds. We did a thorough check on you, and then we realized that such a thing has happened to you, as I explained. And I know it is very sad that this has happened. Uh, at the same time, I know what you're going through now. Uh,
So what you'll do for me,
so
doctor? Can you give me discharge right now? Because I have to attend the wedding ceremony of my niece.
I completely understand how important that event is, and I appreciate and I also recognize that you need to attend that. But keeping the seriousness of the issue what you're going through, you had such a condition, and the placement of this machine was very important. Everything went well, but as a part of the procedure, when we do explain you that what are the possible consequences or complications which might happen, this is one of the possibility that that doesn't make that we are trying to find fault with the procedure itself, but it was a possible complications. But I'm really again sorry and apologize for what you're going through. But coming to your request that you want to go, it is not prudent, it's not wise that you need to attend now because of your health risk. We would like to, as our team discussed, we would like to again ensure that the placement of the lead is done properly and recheck you and assess you properly cardiologically you're fit. Yeah.
When
Then
you
we
want
would
to do
like
this
to.
procedure? When? I mean, how long I have to stay in hospital? I don't want to stay. I mean, when it will take?
Uh, I can understand again this thing, but definitely we'll keep you on top priority. Our team is working hard for this and ensuring every other parameters have taken care in the hospital, availability, the doctor's availability, the team and all. We would keep you on the high list priority. Yeah,
But why your consultant
probably
didn't tell
probably
me
I
about
cannot
that
comment to the.
complication, doctor? Why no one told me that it happened? And you are talking to me that right now, and I'm ready, you know? So what? Why is delayed to consider this information to me?
Uh, I do understand. So, ma'am, what happens is at times this doesn't happen at the time of the procedure. It may have
Mhm.
happened after the procedure is done, and the just prior to after the procedure, they would have inspected you. That would have been fine. But the follow-up rounds, the very fact that we keep you for observation is for this reasons that there are some post procedure complications which may turn up in the next morning. So for that reason, yes, in this morning we could and find this issue, ma'am.
So can you do
Again,
this procedure
I'm
later?
really.
Can I go now home and I can go back later in the hospital? Can I go now?
And I can understand like this thought process, but it will put your life at risk, and we cannot guarantee you what happens because it's not under our control. I understand such a precious event for you. I really appreciate, but keeping our emotions, if we analyze that, your situation can get bad. So if that happens in such a beautiful event, it may spoil your event, and also the people attending them, they may also have a very bad experience. I do understand, but we'll make sure that we can fix this ASAP. Sorry, we can fix this soon and help you with the safe discharge.
How long it will take time, doctor?
Uh, Again, this all depends upon all the team because here every procedure we do it's in the standard procedures, but there is priority list and definitely we'll pick you on top of that. There's a team we have to coordinate with our cardiologists, the pacemaker technicians, the availability of room. But rest be assured, we will keep you on that high priority, ma'am. I cannot come into a time, but whatever possible, you will be the top priority.
Oh my God, what is the news you are giving to me to the morning? And it's really wondering now that you are telling me that I'm not able to go now. Oh my God. So doctor, tell me that why your consultant didn't give me this complication before that when I was agree with that procedure.
Okay. To be honest, I'm not sure how the conversation went and what happened, but rest be assured, if that was the case, that is not our standard procedure or standard practice. But if there was a communication gap, there will be a proper incident report made on this. There will be a proper inquiry done on this, and I would take this. I'm sorry that you had to go through this, but there are pathways where you can raise this issue, and
Two
there are
minutes
teams
left.
independent of our team that they will look into this. Yeah, there are team which will look independently to what happened, and rest be assured, this is all not done in a bad intention. But I cannot comment on what happened in the conversation. But it's not our standard practice that we do this. Uh, any other concerns for me, ma'am? I'm so sorry for that.
So I'm really very much enjoying that you're telling that I'm not able to go and it's life threatening and like there's lots of complication you told me regarding my procedure. If I agree with you, but I mean, when you can give this, even if you cannot tell, I mean, how long I'll stay in this hospital?
Again, I can understand that same thing, but as I said, we'll make it as high priority. That I can assure you that we'll make sure our team works, and yeah.
So you can say that it may take even 7 days, 5 days. I mean, how long? You can't say this. Even you say it's a
This would
displacement.
not
So
be. Yeah, I can. Yeah, this would not be so long. We'll keep you probably a day or two. That would be, in my estimate, the average procedural time what we do in hospital in an average. Yeah, considering any exceptions, but I don't think so. And as I said, you are our top priority, ma'am.
okay, thank you.
Thank you so much for having this consultation. And yes, we will give a team to assign you if you have any concerns or any other help, any other thing that you need. Yeah, we are always ready to help you. Yeah, thank you. We'll
Time
be
is up.
monitoring you.
Thank you.
Yeah,
Time is
thank you.
up. So there is no crossing, and there is in that 3 and 1 ongoing. There's no crossing, and so just I'm giving the feedback, Dr. Danish.
Yes, doctor.
So, Dr. Dinesh, first of all, regarding our communication, the skill you get full satisfactory. You are so soft, polite. It depends. Someone may give borderline because you didn't get the consent. That is another reposition procedure. We may take another consent. And even if you didn't offer regarding the, I'm giving some bruises leaflet that I'm frequently talking about, that why you didn't, your consult didn't tell me that. You said actually the event that happened, I didn't was that you at that time. I was not that there, but actually I have to evaluate. I have to talk with my consultant what actually happened. Is we already taken the consent before this any procedure. We already convey the message what may happen, the complication. But as you're so afraid and as you are raising this concern, obviously you'll get back to us that and I will give the feedback to you for sure. So it depends, either borderline or I mean 2 or 3. It you'll get that marks, but I'm giving you full marks because your sympathy, empathy, voice, your concern and your question answering was satisfactory. Clinical adjustment, as you didn't say regarding the consent, so the clinical adjustment, you lost the mark, so it is a borderline from both sides. Even now the joining of the wedding ceremony, you frequently said you understand that was so very important for you, but your life is on the risk. And again, the clinical adjustment very important is that frequently concern was how long I'll stay in the hospital. I mean, how long you need to do this. Always remember, reposition of this list is emergency. We can't do delay. It takes time within 24 hours. So it's just reposition. I can share that. I can say that it depends, so that it will not be delay. It will be immediately, but I can't say when it occur, but it will be do immediately because it's reposition. It's a life threatening, though you don't have symptom. So frequently this question is a clinical adjustment. You have to ensure there's it's a displacement. We have to do reposition of this list, so it will not be delay. I'm ensuring you. So rather than joining right now, waiting, so you can join later. I understand that was very important for you, for your family, but your life is also so important for us. So you have to ensure. So that's clinical adjustment will be cutting down the mark this way. Okay, so it's only 2 I'm giving. And concern, I'm giving you full marks regarding the concern also, because your sympathetic voice, your every steps of taking care, the answering overall is satisfactory. But even the concern, lastly, how long you didn't meet the number, cutting down from diet to diet 3 still ongoing. Just according to experience, that according to the real concern, how long they are cutting the mark, that's the real exam. Okay, so even whenever how long I need to stay at the hospital, you say, even if you don't know, I'm telling you for sure very shortly after my session or after my meeting, but this will be ensured within soon. But I need to go back to my consultant actually how long it will take time, but it will not be delayed. It will not be delayed this way. You have to meet the concept. If you don't know, indirectly say, I'll go back to right now, or within soon I'll tell you how long it may take, but don't be worried, we are here to help you. So this is the concern, but it examiner to examiner depends. So I'm just giving you full marks, which and welfare also. So it's overall fortune, you can say, according to the 12 in overall, but your performance really good. Appreciated your performance, Dr. Dinesh. So thank you, Dr. Dinesh, for your performance. Nice performance you did. And again, the format, always emphasize on the format. Even I'm writing frequently, always follow the format. So is a breaking bad news? Is it like cancer? No, actually no. But patient is ready for being discharged. It's like a steps, right? For say, as I'm here to as a meeting agenda, do you know anyone else? So this is the proper steps you have to confirm. Do what and also fully Dr. Dennis perform this performance nicely. The 6 points accordingly. That the good news is not for me. There's no good news for me. Nicely done. And the drawing back, Dr. Dennis didn't do it, but best. Always I say for the getting full mark. This is, I really appreciate Royal College in Diet 3, they give it 2 communication. Always appreciate it because this is easy to getting mark fully. Just that we need acting, that's it. So if you do draw a picture, this is the notes, this is we replaced to where it's displaced. Unfortunately, it's a complication. I understand you even know feeling of any weakness, but it can appear anytime. This way, just drawing and clinical picture and as a complication. So overall, the scenario was like that way. Regarding the medical history and the concern meeting, some concern is there that I want to go back and can I go, I can go back later in the hospital, I can join later in the hospital. Actually, we cannot give discharge as it's life-threatening. We cannot give discharge. I understand it's very important, and you can talk with your home via the phone, but it is not mandatory to go or to visit your home because you can be, your life will be on the risk, right, Dr. Dennis? So this way, meeting the concern gradually, nicely performed, but more specific way, better to say. Rather than for going home, you say nicely that's your emotion, your life is more risk, so better to not to go home right now, stay in the hospital and we're observing you. So overall, this was the clinical communication. Any question from anyone from the long clinical case and communication?
Yes, doctor, thank you very much for this.
One by one, yes. One by one, Dr. Is Dr. Meher, right? Or Salma? Who won?
Yes.
Anyone? Yes. Raise the hand and one by one.
Yes, Doctor. May I ask one question?
Yes, doctor.
Yes, regarding the communication case, do we have to raise the issue of driving in this case?
Yes. Actually, driving issue, even Dr. Denisha missed. I would like to say even this always depends. Cause I couldn't say that are you driving now? Because I am not giving the discharge of my patient. So this issue even is misguidedly missed. No problem. I always say examine our hand on the mark. So be safe. Because I'm not giving the discharge of my patient. I'm staying the patient on the hospital so that even if it is not raised mistakenly, no issue. It's according to the examiner, Dr. Maher, right? It's not a problem.
Thank you.
From the clinical
Thank you,
judgment, Salma, yes.
Thank you very much for this nice case. So I was just wondering, like he was apologizing. Is it okay to apologize here?
I'm sorry to say that, or apologizing, actually these 2 words is mandatory because it's not an error. Okay, it's not an error, it's a complication of the procedure, right? So better apologizing, I wouldn't notice so that, so I'm sorry, I understand that, and the word so sympathetically, Dr. Dennis said, I feel so, it's the word whenever you are presenting, it doesn't mean so much horror, no. Your words yourself. I can understand this is so much complication, and you say it's very important to go your home, but I'm really understandable that you can't go right now. That's its place. So it's not apologizing. Every word is countable. Yes, it's sure, but even sorry is the best. I'm sorry to having this complication. I feel Dr. Dennis said sorry frequently, right? Dr. Salma, better to say sorry here.
Yes, this is what my understanding, because this is not the error.
Yes, it's not a, yeah, Dr. Dennis, yes, yes, it can happen anyone. Yes, you are right, Dr. Salma.
Yeah, so we just can sorry. We can just sorry, but not apologize.
Even mistakenly even say if apologize, I said the voice, tone of voice, even it's a soft like understandable. It's not a medical error. It's a complication. It's frequently I'm saying the word of the voice, how you're presenting your case. You understand? So mistakenly, even if you say it doesn't make a long loss of, error, it's not. But you can say, but better to avoid it. Okay, yeah. Doctor. Yeah. Okay.
Yeah,
it's
very
nice. Thank you, Dr. Salma. So if no question, thank you for joining for all. Thank you so much. We are ending our session.